Rheumatoid arthritis is a disease that causes joint pain, swelling, and stiffness, and it's important to recognize the signs and symptoms early on because early treatment can prevent joint damage and disability. And I'll be using information from this study, which is linked below. The signs and symptoms of rheumatoid arthritis can vary from person to person, but some of the most common ones include pain, swelling, stiffness in the joints, especially in the morning or after periods of inactivity. Also, rheumatoid arthritis can cause fatigue, fever, and loss of appetite. Now, the small joints of the hands and feet are usually the first joints to show signs of rheumatoid arthritis, and then the inflammation typically spreads to other joints over time. The most common pattern of joint involvement is symmetrical, meaning that if you have rheumatoid arthritis, you're likely to have pain and swelling in the same joints on both sides of the body. For example, if you have pain and swelling in your right wrist, you're also likely to have pain and swelling in your left wrist. In addition to the signs and symptoms I already mentioned, patients with rheumatoid arthritis also tend to have a normal amount of motion in their affected joints, and this is due to the fact that the type of joint inflammation caused by rheumatoid arthritis affects the joints differently than other types of arthritis. With rheumatoid arthritis, the synovium, which is the tissue that lines the joints, becomes thickened and inflamed, and this inflammation can cause the joints to become loose and hypermobile. Another important thing to note is that rheumatoid arthritis is a systemic disease, which means that it can affect other organs and systems in the body, including the eyes, the skin, the lungs, the heart, and the kidneys. So it's important to see a healthcare provider if you have any concerns. Early recognition and treatment of rheumatoid arthritis is important because it can help prevent joint damage and disability. And the good news is that there are a number of treatment options available, including medications such as disease-modifying anti-rheumatic drugs and biologics, as well as non-pharmacological treatments such as exercise and physical therapy. Again, early recognition and treatment is very important to avoid complications. So I hope this video was helpful. If you enjoyed this video, please share it with your friends. And as always, you can find the references and studies used in this video in the description below. Thanks for watching, and I'll see you next time.